Assalamu alaikum, good morning everyone. Today we embark on critical journey through the landscape of venous thromboembolism or VTE, a significant yet preventable condition that profoundly impacts patient safety within our hospitals. Let's dive into what VTE really encompasses. We are looking at two main conditions here. Deep vein thrombosis or DVT, which occurs when a clot forms in a deep vein, typically in the legs. The second condition is pulmonary embolism or PE, a serious condition where a piece of the clot breaks off traveling to the lungs. This represents a challenging condition in patient care, being a leading cause of preventable hospital deaths globally. Next, let's talk about who is at risk for VTE. Understanding who is at risk is our first line of defense against VTE. Various factors elevate a person's risk, like age, previous VTE episodes, cancer, periods of immobility, or undergoing surgery. Importantly here, hospitalization significantly increases this risk, underscoring our role in identifying these risks and prevention of VTE. Now let's unpack the mechanism behind the clot formation. It revolves around something known as Virchow's triad, which is endothelial injury, stasis of blood, and hypercoagulable state. These factors interplay to create the perfect storm for a clot to form and potentially for a part of it to journey to the lungs, causing pulmonary embolism. In our arsenal of preventive measures, we have anti-embolism stockings and intermittent pneumatic compression devices. Anti-embolism stockings apply pressure to promote blood flow, while the compression devices enhance venous return, combating stasis. This stasis is one of our key enemies in the fight against VTE. Regarding the pharmacological tools we use to prevent VTE, we have low molecular weight heparin and unfractionated heparin. Both are key players in preventing clot formation. Their use tailored to each patient's risk profile is a cornerstone of our VTE prophylaxis strategy. Beyond the immediate dangers, long-term complications like post-thrombotic syndrome and chronic pulmonary hypertension can severely impact the quality of life. Moreover, the economic burden on our healthcare system is substantial, further emphasizing the importance of preventive measures. In closing, understanding VTE's fundamentals enhances our ability to prevent it, making a profound difference in our patients' lives. As we move forward, remember each patient's safety is in our hands, and together we can significantly reduce the risk of VTE in our hospitals. Thank you for joining us.